Hello friends, welcome to my YouTube channel. So today in this video I am going to discuss about the anatomy of the ear. So let's get started. So anatomically, ear is divided into three parts: the external ear, the middle ear, and the inner ear. So in this video, I'm going to discuss about the anatomy of the external ear. External ear is consists of the pinna and the external acoustic canal, which is also called the auditory canal. So talking about the anatomy of the pinna, so pinna is actually it is entirely made up of a single framework of cartilage, that's yellow elastic cartilage, except the lobule. It is all the part is made up of cartilage except the lobule, which consists of fats. So like if we see from the lateral surface, there are many elevations and depressions which can be seen in the pinna. So continuing from the lobule, there is a small elevation, cartilaginous elevation, that's called the tragus, and just opposite to the tragus is the antitragus. If we continue from the tragus, we can see the incisura terminalis. It's a structure which is devoid of any kind of cartilage. So the clinical importance of this structure is that for endural approaches in the surgery of external auditory canal or the mastoid, so incision is made in this area, and so there is no need to cut the other cartilaginous part since it is devoid of cartilage. So this is the area which is usually preferred for the incision, and the surgery is carried out. And continuing from the incisura terminalis is the crus of helix. So like we can say that the incisura terminalis, it is present between the crus of the helix and the tragus. And like continuing from the crus of helix is the helix part, which moves upward, forward, upward, backward, and downwards, and it continues into the lobule. There is another elevation called as antihelix, and another like Simba conche, and between these two elevations they are triangular fossa. And there is another depression, we can say, that is called the concha or the concha, which continues into the external acoustic canal. So what's the importance of this pinna? The most nowadays, which is quite it is used, that is, it acts as a source of graft material. From like we can take the cartilage from the tragus can be used, or the perichondrium. Perichondrium is the layer which covers the cartilage. So like peri means outermost and the chondrium means cartilage, so it's a layer which covers the cartilage. So like that can be used for the reconstructive surgery of the middle ear, and this fat from the lobule also can be used for the reconstructive surgery of the middle ear. And and other cartilages part of the spina can also be used for the repair of any kind of defect in the nasal ala which is present in the nose. So any kind of defect that can be repaired by using this cartilage. So next we can see the external acoustic canal. First of all, the most important point for the external acoustic canal is it is not a straight tube. Actually, the direction, if we talk about, it consists of two parts: the cartilaginous, which is the outer part, and the bony, which is the inner part. Total length of the external acoustic canal is 24 mm, and of that, one third is the cartilaginous part, 8 mm, and bony part 16 mm, which is the inner two-third of the external acoustic canal. So like if we talk about the direction, outer part is directed outward, backward, and medially, whereas the outward or upward, backward, and medially, whereas the inner part is directed downward, forward, and medially. So the direction comes like this. If we talk about that, this is the ear and the face is this side. So the direction of the external acoustic meters would be like this, like directed forward, medially, and downward, the inner part, and the outer part directed outward, upward, outward or upward, medially, and backward. So this is the direction of the uh, external acoustic canal. Importance of this, the direction of the acoustic canal is that in order to see the tympanic membrane, the pinna has to be pulled upward, backward, and laterally in order to see the tympanic membrane clearly. And this is done in order to bring the two parts in the alignment, that is the cartilaginous and the bony part. So talking about the importance of the cartilaginous part is that it is nothing but a continuation of the cartilaginous structure of the pinna. It continues into the outer one third of the external acoustic meatus and leads to formation of cartilaginous part. The importance is that there are 2 points where the cartilaginous part is deficient, and the point is called the fissure of Santorini. And the clinical importance of this fissure is, due to this fissure, the infection of the external acoustic meatus leads to the like migrate to the surrounding area. If we talk about the relation of external acoustic this external acoustic canal, that is, anteriorly is present the temporomandibular joint, inferiorly is the parotid gland, superiorly is the middle cranial fossa, and posteriorly is the mastoid air cells and the facial nerve. So, due to this fissure, the infection of the external acoustic canal that migrates into the parotid gland and can migrate also in the mastoid air cell, and vice versa can also happen. This is its importance. And if we talk about the outer one third of the this cartilaginous part, it is confined, the hairs are confined to this outer one third only. So due to this hair, that can lead to the staphylococcal infection, and that staphylococcal infections are called furuncles. So furuncles are more common in the cartilaginous part of the external acoustic canal. And now if we discuss about the bony part is, as we have discussed, that it is of 16 mm in length. So 6 mm, like 6 millimeter lateral to the to this the tympanic membrane is somewhat bulged into the external acoustic canal. So this bulged part is called the isthmus. Due to this, the external in here, the as we can see that due to this isthmus, the external acoustic canal somewhat gets narrowed. So the clinical importance is that if any foreign object or foreign body, it can get lodged if it is present between the like lateral to the tympanic membrane and medial to isthmus, it gets lodged in this area, and it is very difficult to remove this debris. So this is its clinical importance. And there's some like anterior inferiorly in the anterior inferior part of the external acoustic canal, there's some recess present, and that recess is this recess is called the it act as a cesspool for like discharge and debris of any kind of middle ear or external ear infection. So it act as a cesspool or as a container, so infection gets lodged in it. So yeah. And some conditions, one condition, important condition, which is seen in children's or children's of 4 year up to 4 years of age, or it can also be seen in the adults also, is that sometimes what happens, the anterior inferior part of this external acoustic meatus, the uh, bony part, it is deficient. So this deficient part is called the foramen of Huske. Due to this foramen of Huske, the infection of the external acoustic canal can migrate into the parotid gland, because the bony part is devoid. There is deficiency of the bony part. So due to this, the infection can migrate. So this is the importance of foramen of Huske. So that's all for this external ear. So just subscribe my channel and hit the bell icon so that you don't miss the further like lectures which I will be uploading soon. So thank you.